Bridal Outlook Vision is a specialty vision practice here in North Charleston that provides compassionate, thorough care for children and adults with vision needs. Today, I talk one-on-one with Dr. Jesse Willingham of Bridal Outlook Vision for this edition of Quintin's Close-Ups, sponsored by the law office of Idris Jenkins. And if you haven't already, subscribe to my YouTube channel and like Quintin's Close-Ups on Facebook. Dr. Jesse Willingham, welcome back to Quintin's Close-Ups.
Thank you very much for having me again. I enjoyed it last time.
I appreciate it too. And I want to let the viewers know that this particular interview is sponsored by the law office of Idris J. Jenkins, LLC. And Dr. Willingham, of course, you are a residency training developmental
optometrist, yes. Developmental vision and vision rehabilitation, yes.
Yeah, right here at obviously Brighter Vision Outlook here in North Charleston. And obviously your in-depth approach goes far beyond a basic 20/20 check, uncovering wherever vision challenges are holding people back and crafting personalized solutions to help you thrive. So tell me, what's new, what's now right here?
Let's see what's now right here. So the main thing that we are introducing as a new tool to access in our office right now is a myopia management program. So as developmental and vision rehabilitation specialists, we specialize in functional vision issues where people have maybe eye coordination issues, especially children that can impact their reading and learning, but especially since COVID. But in general, children are having spikes in nearsightedness, right? And so we think about nearsightedness as you just need glasses to see far away. But the more nearsighted you become, the more likely you are to have life-changing eye diseases as you get older. And so any amount of that we can prevent as you're younger is important. So we have myopia management programs here to help out children and to reduce that amount of myopia they gain throughout those developmental years.
And what exactly are those life-changing diseases that you and your team are keeping an eye on from a trending standpoint?
Yes, so as you are nearsighted, especially if you get into the highly nearsighted category, so if you know your prescription like a -4, -5 or higher, you are at a huge increase of risk for retinal detachment, which is where the retina, the inner neural lining of the eye that connects the eye and brain, becomes detached and can become permanently damaged and affect your vision. It can be a blinding condition requiring major surgeries. There's also myopic maculopathy, which there is not a good treatment for right now. If retinal detachments are caught early, a good surgeon can really help repair that and restore and save a lot of vision. But with myopic maculopathy, it's a lot like macular degeneration, an age-related condition, and it can be slowed down, it can be monitored, but it can't be cured at this point. So it is a form of permanent vision loss.
Wow. So you mentioned age-related, doctor. So what's the typical demographic that deals with this, unfortunately?
So the most myopia or nearsightedness occurs and increases between the ages 8 and 12, which is why those early eye exams are very important. Because even if you haven't turned nearsighted yet, we have a lot of data and tools that can calculate overall risk. So if we're seeing you early at a special clinic like ours, then we can really get on top of it. So if a child has just 1 or 2 parents that's nearsighted, their risk goes way up from a genetic standpoint, so they should be getting checked even if they're not showing symptoms. And even children who get vision screeners at the pediatrician and at school should get full eye exams as well, because oftentimes those vision screeners just miss things. You know, they're a screening, they're not perfect. They're really important to be done, and it's great that schools and pediatricians do that. But we have so many great eye doctors in this area, there's no reason to not get checked more thoroughly.
So what exactly are people missing, well, those doctors are missing when it comes to those eye exams for those particular kids?
So just in school screeners and with pediatrician screeners, you know, the thing is kids are just really good at tricking machines sometimes. Sometimes it's that their eyes are so powerful and can change focus so much that if it's done on an automated machine, it just gets an error and a misreading sometimes on those kids, right? Sometimes if it's a kid that sees really well in one eye and not the other, and they're asked to cover one eye and read a letter chart and then cover the other, they might have memorized the letters, or they might peek. You know, kids are kids and they want to do good. They usually want to please the adults around them and they want to get the answers right on the test. So that's why it's just important to have multiple checks.
Wow. And how many checks are ideal in that particular setting?
You know, ideally for me, any school-aged kid is getting screened while they're in school, because these things can change throughout the year. It's wintertime right now, and people tend to actually be more nearsighted, more myopic in the wintertime than they are in the summertime. Just like we get more flus and colds, those upper respiratory things in the wintertime for being indoors more. Same thing, our vision's a little bit more nearsighted, so getting checked multiple times throughout the year is important. But kind of back to the original question, I think that every child should be checked before school age by an optometrist or an ophthalmologist with a full eye exam to look at not just their visual acuity, but actually do a really good test with lenses to see what their refractive status is, if they're nearsighted, farsighted, have astigmatism, and make sure the eyes are healthy so they have a comprehensive eye exam and vision exam.
What lenses are providing, I should say provided, are actually contributing to a lot of these problems?
What lenses are? So that's interesting you ask, because that's a really heavily debated thing with nearsightedness and myopia control, right? So if you're farsighted and you're a young kid, if you're not too farsighted, ideally you don't need any glasses, right? There is some theories and research that suggest that traditional lenses, glasses, for nearsightedness do give you that sharp vision. So in a way it kind of corrects nearsightedness is the term that we use, but some attributes of those lenses might actually encourage the eye to continue to grow and become more and more nearsighted. So there are very specially designed lenses, not actually glasses lenses available in the US, but contact lenses for children that deliver a different kind of information and visual quality to the eye that discourages that excessive eye growth and slows that down.
What exactly is the vision quality for those people in the winter?
In the winter? Yeah, so visual quality can go down for several reasons in the winter time. If we think about just kind of the most immediate thing, everything is drier in winter. When heat is turned on, just like your skin dries out, your eye dries out. So visual quality can go down from dry eyes. So if you're experiencing burning, itching, redness, or even excessive tearing in the winter time, that's all signs of ocular surface disease, and that can affect anyone from children to older individuals. And so optometrists and eye doctors are particularly poised to well manage those conditions. You don't have to just see your eye doctor for glasses. You know, we can manage skin conditions like dry eye as well. But from a more long-standing standpoint, if you're getting your eye exam in the wintertime, when you're more likely to be nearsighted, you're more likely to receive maybe a stronger prescription from that, which is going to help you if you're having trouble seeing at nighttime, those kinds of things. So if you want the doctor to see you at your worst, that's a good time if you're struggling with those kinds of things like driving at night. But it's important from a developmental standpoint for children whose eyes change a lot more year over year for us to consider that children are probably seeing worse in the wintertime than they would in the summertime, and to take that into consideration. So children whose vision is changing a lot rapidly need to be seen more often than just 1 year. And when we have children in a myopia management program here, we see them quarterly, every 3 months.
Wow. So, Doc, year to year, what other conditions are you and your team seeing when it comes to issues with your vision and obviously the winter?
In the winter. So again, just the huge increase in dry eye problems is the biggest thing, and that's not so much for our specialty clinic here, but for children, what we just see is it oftentimes is whenever their symptoms spike, right? A lot of children with developmental vision issues that affect things like reading. Whenever we're inside more often, they're more likely to have symptoms from that. So if you have eye coordination issues, you have to strain your eyes to focus more clearly. You're spending more time inside, on the computer, in the books and reading. You're more likely to have children who are going to say they can't see well at the end of the day. Children who are complaining of headaches or having to rub their eyes a lot, right? Oftentimes, the headaches are one of the toughest things to diagnose, but children in general shouldn't have headaches. One of the most common reasons children have headaches is dehydration, but vision issues is probably the second most common issue.
Wow, what are those other hidden diagnoses that you and your team keep seeing?
Yeah, so the main diagnoses that we find in children are, number one, just growing by and large, is myopia. And myopia and nearsightedness, you're used to seeing people in glasses, but that's an abnormal condition as far as human biology is considered. After that, the second most common thing we see is convergence insufficiency. This is a condition where the two eyes, whenever they have to triangulate and look at a target up near, don't match up. So one eye doesn't want to go in as far as the other. And at first, that can cause, if you're not having too much issues with, a lot of strain from trying to keep it happening. But as you fatigue over time, your eyes are going to be misaligned and you actually start to get double vision, which causes a really kind of mental fatigue having to deal with that.
Whoa. And sometimes I will admit too, some of my fatigues probably in the winter is getting a little sleepy sometimes.
Absolutely.
Do you see that with other patients?
I do think that as humans, we don't necessarily need to hibernate, but I think we should learn from nature. And we should take some time and sit back in the wintertime. There's less sunlight hours. We need to be enjoying that sunlight while we can. Sunlight is so important for our circadian rhythms and our natural ability to fall asleep whenever we're supposed to. And then avoiding that too much light at the end of the day when we're supposed to be going to sleep. So if you are sleepy, we do know that light from screens can actually trigger cells in the retina, in the eye, that will send information to the brain to say, hey, it's daytime. We need to be awake. And that is moving the clock further and further back from when your brain can actually enter sleep. So avoiding screens late at night is very, very important if you find yourself being sleepy and fatigued in the wintertime.
And when it comes to kids, what protocols should they follow?
Personally, I don't think that children should be spending more than 5 hours a week outside of their school time on digital devices and screens. Real play with actual toys outside in sunlight is very important for motor development, for visual development, for social development as well. So making sure that you're not spending too much time on the screen, and no screen time an hour before your bedtime.
Wow, that's good information. Yes, indeed. Well, Dr. Jesse Willingham with the Brighter Outlook Vision, thank you for your time again. Welcome back to Quintin School Subs, and we want to thank the law office of Idris Jenkins for sponsoring this interview.
Thank you so much for the interview, Quintin. I always enjoy getting the information out there.
Thank you. Yeah.